Good evening. My name's Jillian Perkins. I'm fumbling at my own name here. That's not a good sign. I'm the Associate Hospital Director, and I'm very pleased to introduce Toby Pinn. She is working in our diagnostic lab and in the hospital, so she wears many hats here. And basically, Toby, I've known for a long time because she was a large animal medicine resident here. So we trained her. But before that, she went to the University of Wisconsin for vet school. And then when she finished her residency training here, she went to Vermont Large Animal Clinic and worked there. And then she came back this direction and worked for Eastview Vet Clinic. So maybe some of you have seen her out on the farms. And now she's back with us. I'm so happy to have her back because she actually also loves infection control just like me. So hopefully I've rubbed off in a good way for Toby. And of course, this is a very in the front topic right now with all the COVID stuff going on. Obviously, that's for people. This is all about horses today. So we're just going to focus on how you can keep your horse safe and different horse events and some horse diseases, but we will not be talking about equine coronavirus. We have equine, but not people coronavirus. Okay. Exactly. All right. Well, I won't fumble through this anymore, but thanks for being online.
All right. Hopefully you guys can all hear me. All right. Thank you so much for coming, especially late on a weekday night. So we're going to go through some equine infectious diseases that we're more likely to encounter and how these diseases are spread and how we can prevent them and protect our horses. So we'll talk about maintaining biosecurity on our own farms and when we're traveling off the farm with our horses. And then the diseases that I'm going to review are strangles, equine coronavirus, equine herpes virus, and equine influenza. So just to put it all in perspective, our horses share germs just like kids in preschool or any large group of people does when they're all kind of commingled together. So, have these nice pictures of a foal licking a salt block, and lots of other horses have licked that same salt block, and then the foal goes over and touches noses with someone on the other side of the fence who's not part of his group. So there's the potential there for shedding germs, just like putting toys in our mouths at daycare. So what is an infectious disease? It's a disorder that's caused by organisms such as bacteria, viruses, fungi, or even parasites. And something that is contagious is a disease that can be spread from one horse to another, either through direct contact between horses or indirect contact, such as one horse touching the fence and then the other horse going up and touching the same spot. So we're really just going to focus on contagious infectious diseases tonight. So sometimes we don't always have infectious disease on our minds, like when we're away having fun at a show, but it's kind of important to remember that it's kind of lurking in plain sight. We just want to keep it in perspective. So, these horses are standing all in a nice line at a show, and they might be shedding something contagious that you can't see, but they could also be sharing that with the neighboring horse next door if they reach over and touch noses, or if they sneeze and a horse walks by through that spray. So these horses all look nice and healthy. Everybody looks happy, but there's always a little bit of a risk when we travel with our horses and are around new populations. We can't always see that risk clearly. So what do we do about this? Unfortunately, bubble wrap is not the answer. But we can educate ourselves and know how to prevent or try to prevent our horses from becoming infected with contagious diseases. So first off, we need to understand how they're spread. So fecal oral transfer is one. So some horses can pass contagious diseases in their manure, and then another horse can walk over and sniff that manure, or some of us I'm sure have seen other horses eating each other's manure, or manure gets onto some object that the horse puts in its mouth. So that's one way. Aerosol droplets like a sneeze or a cough, and the bacteria or virus gets kind of into the air and can travel to the airspace of another horse. direct nose-to-nose contact, and then fomites. So what are fomites? Okay, so fomites are inanimate objects that can get contaminated with these infectious diseases, with bacteria, viruses. So our hands are fomites, which is why right now we're using hand sanitizer and trying to, during cold and flu season for ourselves, we're trying to keep our hands clean, but we need to remember that that's how we can spread disease to horses as well. Our shoes, tracking manure on our shoes, cleaning tools, muck buckets, pitchforks, the wheelbarrow itself, trailers, horses sharing trailers, not cleaning a trailer between different groups of horses. They can come in contact with each other's germs. And then things like shared waterers, those are also considered fomites. So what does biosecurity mean? I think right now with everything that's in the media, our blood pressure goes up just a little bit when we think about biosecurity, but I'd rather instead that we think of it as that we are here kind of superheroes to protect our horses and prevent infectious disease. And biosecurity is those precautions that we take to protect our animals from these diseases. And hopefully get them out of our environment or keep our horses out of environments that have them. So one of the most important tools that we have for prevention is vaccination. So we can introduce the disease to our horse through vaccine in an inactivated way that just alerts its immune system so that it makes antibodies. And when it is actually faced with that disease out in the world somewhere, its body is ready to produce more antibodies in response to that threat and hopefully neutralize it and prevent the horse from getting sick. So we have vaccines for a lot of the common infectious diseases that our horses might come in contact with, but not all of them. So we still have to practice good biosecurity measures outside of vaccination to protect from those diseases. And vaccines are not foolproof. They're not 100%. They might prevent our horses from getting more sick than they would have if they weren't vaccinated, or they may prevent the disease entirely. And not every horse's immune system is the same. We can't always predict how a horse will respond to vaccine. So again, we have to take other precautions. And working with your veterinarian to discuss what are the diseases that you should be vaccinating against in your area is very important. So coming up with a strategic plan with your veterinarian is important. More tools for prevention, particularly when we're bringing new horses onto our premise, not only when they're coming from large sales or large auctions, but also when they're coming from smaller farms, they can bring infectious disease to their new home. Certainly, taking a horse from an environment where it's been commingled with a bunch of other horses from different environments increases that risk that they could come in contact with something infectious. But again, like I said, just taking a horse out of a pasture with maybe one other horse still poses a risk. So we should bring those horses to their new home and keep them separated from the resident horses on that farm. We usually say for about 30 days, because that's an amount of time that would cover the various infectious diseases that we're concerned with and when those diseases might manifest. So it's a safe window of time. And the kind of space that you'd put that horse in is one where it wouldn't have nose-to-nose contact with other horses on the farm, where all of its management can be kept separate. You can manage its manure separately. And not everyone has a space like this at their home, or at their barn. But there are a lot of ways we can sort of adapt and improvise when we don't have the ideal setup. But that's kind of what we're aiming for. Other things that you want to do is think about how people are moving on and off farms and between horses. So ideally, when people are going between farms, they shouldn't be, wearing dirty shoes between farms and tracking manure, they should clean them or put on a different pair. Maybe they have dedicated shoes for different farms. And then clothing, if they're going between barns, good idea to change our clothing, or at least if we've gotten pretty dirty, to put on a new layer that protects the dirty layer. And then, of course, we have equine professionals like veterinarians, farriers, trainers, person doing chiro, acupuncture, et cetera, going between lots of barns. And it's never a bad idea to have a conversation with that person about what their practices are between barns, if that makes you feel more comfortable. In an ideal world, they're cleaning their shoes and washing their hands. And any equipment that they're sharing between different farms, they're disinfecting before they take it to the next farm. So we, as the horse owner, need to provide spaces for the vets and these professionals to clean their tools. Just setting out a bucket of warm water and some soap and a little brush goes a long way. Having it readily available makes sure it gets used. And then if you have a horse that might be sick on your farm, it's great to tell those equine professionals before they visit so that they can schedule you maybe at the end of the day so that they don't go to any other farms afterwards. Give them that information so that they can adjust their schedule accordingly. And of course, the horses that have infectious disease need treatment too. But again, try to let the professionals know so that if those horses are sick, they can schedule it such that they have time to clean up after treating them before going to the next farm. So some things that I think about a lot and that we use a lot in the field as veterinarians are, equine dentistry equipment. It's in and out of a lot of different horses' mouths. And so we have a lot of nice ways to clean those instruments prior to going to the next farm. So when we are traveling with our horses, we can do a few things to lower their risk of coming in contact with infectious disease. We can take our own equipment with us. Feed buckets, water buckets, cleaning tools, so that we're not borrowing other people's. We can avoid communal areas as much as possible. So if there's like a common tie rail, you may choose to tie your horse to your trailer instead of next to a horse that you don't know, or you don't know where that horse came from. And in doing so, you can also try to limit your horse's contact, nose-to-nose contact with other horses. Washing your hands when you're at these events as much as you can between horses is important, or just taking some hand sanitizer with you. And then trying to minimize your horse's contact with the manure from other horses. A lot of horses love to reach down and sniff piles that are on the ground, but we just try to discourage that. There are also some great tools out there to help us as owners kind of keep tabs on what's going on, what diseases are circulating in the equine population in the United States. So this is called the Equine Disease Communication Center, and this is a website that you can go to. Not only does it have a lot of information about biosecurity and how to handle different diseases and situations, it also updates regularly by state with infectious disease events and the equine populations there. So I just clicked on New York State, and it showed me that one of the most recent reports was in late February, and there were some cases of herpes virus in Saratoga County. So if you're traveling with your horse and you're trying to figure out what might be cooking in places you're going, or should you have anything on your radar, this is a great place to go. So now I'm just going to talk about a few of those diseases that we might encounter. So you have some of that knowledge for how to recognize those diseases and how we prevent them. So this is a horse that to me, he looks dull and I can't tell exactly what's wrong with him. It just looks like he doesn't feel good. And sometimes, it is not possible when horses initially present to say exactly what's wrong with them by looking. So we might have to do some diagnostics to figure that out. So strangles is one of those diseases that is circulating in our equine populations. And it's kind of a pain when it affects a horse that's on your farm, or, it's something that we all worry about. So it's a bacterial infection. The bacteria is called Streptococcus equi, subspecies equi. It is spread through often nasal discharge or discharge from draining abscesses, and often nose-to-nose contact between horses, where one horse smears its nasal discharge on the other, or if they get their discharge on a fomite, like we talked about, hands, buckets, shared water troughs, and then another horse comes in contact with that object, they can get infected that way. These horses oftentimes just kind of ain't doing right. They are off feed, have a fever. They will have really thick, cloudy nasal discharge, like you can see in the picture. They get swollen lymph nodes under their chin, and sort of that throat latch region. And they can have difficulty breathing as well. So the picture in the upper right is some swollen lymph nodes. And the reason this disease is called strangles is the swelling that occurs can actually obstruct their airway. And sometimes they have enough trouble breathing that they have to have a tracheotomy. So that's how the disease gets its name. One place that this bacteria likes to hide is in a part of the horse's upper airway called the guttural pouch. So this pouch has some lymph nodes that are hiding under the floor, and when they swell and get infected, they will open and drain into that pouch, and the discharge makes its way out their nose. So we can't see these pouches from the outside, we just see the nasal discharge. But what's happening on the inside, and the way we've acquired this image is using an endoscope, is this little volcano of pus coming out of the floor of their guttural pouch. So when horses become infected with strangles, the first fever occurs about 3 to 14 days after exposure, and then their lymph nodes will begin to swell, abscess, and drain, as I mentioned. An infected horse can be contagious to others through nasal shedding, and these horses can remain contagious for weeks to months after infection. So if there is an outbreak, sometimes we can catch horses after their first fever and treat them before they get any of this lymph node swelling, abscessation, or drainage, and prevent them from getting fulminant disease. But we have to be monitoring them carefully. So that's really only in an outbreak situation where we can catch that. A lot of times an owner might not notice their horse is sick until the lymph nodes are very large and they see that there is nasal discharge or discharge coming from the lymph nodes, or the horse is acting sick. So there are a few ways we can make this diagnosis. We can either take a swab of the discharge and grow the bacteria in culture, or we can look for the bacteria's DNA using a test called PCR. And the way we collect these samples is either just a nasal swab, just sticking a long-handled, basically Q-tip up the horse's nose and getting a sample of the discharge. That's one way. But you can see where the red sort of star is, that's the horse's guttural pouch. And the nasal swab doesn't get all the way back there. So we're hoping that we just catch some of the discharge on its way out if we get lucky. Another way that's even better than a swab is called a nasopharyngeal wash. So this is where the veterinarian passes a long, flexible, narrow tube up the horse's nose and squirts some saline and catches the saline as it washes the nasal passage, and hopefully washes out some of that bacteria into our sample. So this is a great way, without doing anything too invasive, to get closer to the guttural pouch and try to get a sample of that bacteria. And then finally, we can use an endoscope, which is a little flexible camera that we can pass up the horse's nose. We can actually pass it into the guttural pouch and look around, see if there's an enlarged lymph node there, and see if there's discharge. But this requires some sedation often, and your veterinarian to have this equipment, or to take your horse somewhere where a vet has this equipment. So a lot of vets in the field test for this disease with a swab or a nasopharyngeal wash. So oftentimes, as I mentioned, we don't catch this disease until the horses are well into the course of disease with swollen, draining lymph nodes. And at that point, we usually just let it run its course. Sometimes if horses are having complications such as airway obstruction or other things, we might start them on antibiotics. And like I said, during outbreaks, sometimes when we're monitoring all the horses and we can catch a first fever, we'll be able to start them on antibiotics before they get further into the course of disease. So one of the things that's tricky about strangles is there are horses oftentimes that have recovered from infection that are acting perfectly healthy, but they can still have the bacteria hiding in their guttural pouch, and they can be contagious to others, even though they look perfectly fine. So these are called asymptomatic carriers, and this is one of the main ways that this disease is kind of maintained in our equine populations and how it gets transferred from horse to horse. Something else that happens is the discharge that gets stuck in the guttural pouch can dry up into kind of hard balls, and it also traps the bacteria there. So that's another way that these horses will continue to remain contagious with the bacteria kind of trapped in their guttural pouch. So when strangles is diagnosed, usually the farm is quarantined to prevent any movement on or off the farm while the horses run through their course of disease and are no longer contagious to others. Usually, this is roughly 28 days, and in an ideal world, we would test the horses that were diagnosed with strangles prior to lifting the quarantine to confirm that they're not contagious to anyone and that they can move freely, and that people can come and go on that farm without worrying about picking up strangles and taking it anywhere with them. So, as I mentioned, the challenges of this disease from a biosecurity perspective are that sometimes there's a delay between exposure to when the horse becomes clinical. So, it's hard to monitor. It's spread very easily on these inanimate objects. So, it's easy for a horse to get infected if it's in their environment. And horses remain contagious for a long time after becoming infected, and so it's easy for them to infect others without looking sick. And so this is one to be aware of. We can prevent it, or at least try through vaccination. There's a couple different vaccine options out there. One is given up the nose, and another is given in the muscle. And we recommend vaccinating horses that are considered at higher risk. So those horses that travel a lot, or that live on farms where horses are coming and going frequently, such as sale barns, rescue farms, and training and show barns. So now I'll talk about equine coronavirus, which, as we sort of mentioned, is species specific to horses and distinct from COVID-19. So we are talking about equine coronavirus here. So this is a disease that is shed in horses' manure. In other species, other mammals, a lot of mammals have their own coronaviruses, and they actually, in other species, can be shed through a respiratory, through the nasal discharge. But in horses, we believe it's mainly shed in their manure. And it's not shed consistently. It can be shed kind of on and off in horses that are infected, so intermittently shed. We do see more cases in the wintertime, but it is seen year-round. We do see it occasionally in the summer as well. And the clinical signs are kind of vague. These horses will get a fever, they'll go off feed, act dull. They might be mildly colicky. They might have some soft manure. Rarely are they sicker than that. They can occasionally get more sick, but most of the time, it's like I said, dull attitude, soft manure, mild colic. And again, we'd make this diagnosis by collecting a manure sample and looking for the DNA of the virus using a test called PCR. So treatment, there's no silver bullet treatment. It is just supportive care because this is viral. And sometimes when horses are more sick, they might need fluids to keep them hydrated, anti-inflammatories to control their fevers, sometimes antibiotics. And we try to prevent some complications of fevers with icing of the feet. Most of the time, these horses are managed on the farm, but occasionally they do have to go to a hospital. And again, one of the tricky things about coronavirus is when there is an outbreak, in addition to the horses that have been diagnosed, there are usually horses that are not acting sick, but shedding the virus on the farm. So I was sort of trying to depict that, on the left-hand side, we have 3 diagnosed horses, and on the right-hand side, we have the rest of the farm that's acting perfectly fine. But even within that group, there's a horse who's contagious. And he hasn't showed us any clinical signs, so we don't necessarily know he's out there. So that's one way that it kind of gets maintained in populations is through these asymptomatic shedders. So it's a challenge to manage from a biosecurity perspective because it's very easily spread on our boots. We track through manure all the time on farms. This is why it's so important to, kind of clean our boots before we leave one farm and go to another. It is critical to use foot baths with this disease. And there is some limited research showing that most horses out there, like they looked at a population of horses coming to a hospital that were not sick horses, but there for elective procedures, as well as a group of horses that went to a large exhibition at a state fair. And there was one horse out of 100 that was shedding. So it seems like there are quite a few horses out there that are not shedding. So we don't think that healthy horses are running rampant shedding this disease. This is one of the diseases where there's a lot of ongoing research. We need to learn more about how it's shed and how to control it. And we're kind of learning a little bit more all the time. So equine herpes virus. This is one that I think makes the news more than others. There are 2 types. There are more than 2 types, but the types we're going to talk about tonight that you're more likely to run into and need to vaccinate against are types 1 and 4. They cause respiratory disease, abortion, and they can cause neurologic disease. So this virus is one that many foals are exposed to early in life, even from their own dam. And they become exposed, they don't get very sick, and it just kind of goes latent or dormant in their body. And it can recrudesce, and they can start to shed it and be contagious to others during times of stress. So maybe travel, showing, training. Sometimes when horses become sick with this virus, it's not necessarily because they came in contact with another sick horse. It could be that they've recrudesced their own virus. So it's spread through nose-to-nose contact mainly. And if there is an abortion that is secondary to equine herpes virus, it is also shed in the placenta and the fluids that are passed by the mare after foaling. And then as well as contact with fomites, so human hands, shared feed buckets, etc. So sometimes clinical signs are very mild and inapparent. So again, horses that are sick with equine herpes virus might not appear sick to the average person, even those that know the horse very well, but yet they can still be contagious. The respiratory signs will develop anywhere from 3 to 10 days after exposure and can last about 10 days. These horses will have kind of a dull attitude, fever, increased respiratory rate, some kind of more mild nasal discharge, and they might also get some swollen lymph nodes under their throat latch region. These don't abscess and drain. They're just swollen because they're kind of responding to the viral infection. When mares abort, often it is secondary to EHV1. It's usually toward the end of pregnancy in the last third. There's not always a warning sign, and if the foals are born alive, they don't typically live very long. And then the form of equine herpes virus, like I said, that is kind of makes the news and we read about more in our equine periodicals, is the form that causes neurologic disease. This can have a big impact economically. For example, if we have the neurologic form of herpes occurring, in Florida during big show season, that can really put a damper on things. Or if it happens at a racetrack, that can shut down the racetrack for a period of time. So this is something that we monitor for very carefully. Also, because horses that do become neurologic from it don't always have a good prognosis. So we really want to try to contain it when it occurs. They don't always have respiratory signs prior to developing the neurologic form of disease. And clinical signs can develop, the neurologic signs can develop roughly a week after exposure. And they will have a fever, which you may or may not catch, but then they typically develop hind end weakness, difficulty urinating and passing manure. They might dribble urine, and they lose kind of their tail tone. Those are just some of the signs. Again, there's not a magic bullet treatment. It's supportive care for these horses, anti-inflammatories, and everything we can institute to keep them standing. We often have to use the slings and help them urinate, pass manure, protect them from secondary bacterial infections, and sometimes antivirals are used. So we diagnose this disease again by looking for the DNA of the virus. And we do actually have some tests that can help us determine a little bit better if our horses are needing to be vaccinated. Some horses, as I said, have different immune systems. We can't always predict how our horse will respond to vaccine. So there is a test out there now that helps us assess the horse's risk if exposed to equine herpes type 1, what their risk is for developing clinical disease. And it can help us determine if we should give a booster vaccine. So for owners that are traveling a lot with their horses or have their horses exposed to a lot of other horses traveling, this is a test that might be used to help them stay on top of their vaccination program. For biosecurity with this disease, these horses can remain contagious for about 14 days, and we usually keep them isolated for about a month, disinfecting all surfaces. And thankfully, this bacteria is easily killed with some of our common disinfectants. Again, there is a vaccine available. It does try to prevent disease and is definitely necessary. It's considered a core vaccine necessary for horses that are showing and exposed to horses that are traveling. And then there is actually a special form of this vaccine for pregnant mares to try to prevent them from having abortion. And then the last infectious disease that we'll talk about is equine influenza virus. So this virus is tricky because it can be transmitted over long distances through aerosol droplets, and so through coughing and sneezing. So even if you have a stall that is separate from others, if it's within the same barn as a horse with influenza, and they're sharing that airspace, there's still the possibility, even if they don't have direct contact with each other, that the horse could become sick. So this is a little bit hard to control. These horses will show dullness, fever. They might get swollen lymph nodes and have some nasal discharge as well. Usually we see clinical signs just roughly 2 days after they've been exposed, and they will be shedding and contagious at that point. they will remain contagious for roughly a week, and we usually keep them isolated for about 2 weeks. And they can continue to cough and have kind of a reactive airway beyond the point at which they're contagious. So again, taking a respiratory sample, we can look for the DNA of this virus using PCR. We treat these horses again with supportive care and antibiotics to prevent secondary bacterial infections. And we do have a vaccine. So when we're managing these various diseases, should an outbreak occur, there are different things that kind of come into play. We have to take into account what's the stable environment, what are the limitations of that environment? Can we separate horses? Do we have a good area to isolate horses in that facility? And then what do we know about the disease? As I mentioned with equine coronavirus, we don't know as much about shedding and how long horses remain contagious as we do some of these other viruses. So we have to use what we know. And then we also, some of these diseases are reportable to the state ag and markets and are kind of monitored and managed by them should a diagnosis be made in the state. And different states have different laws and regulations about these different infectious diseases. And so again, that EDCC website actually has a lot of information on that. So what do we do if on our farm we have a horse that we think is sick and may have a contagious infectious disease? Well, as soon as a horse is known to have a fever, we should call the vet and get them involved. And as soon as we think there might be a contagious infectious disease, we should limit movement on and off the farm until we know more about what's going on. So as I mentioned, the quarantines and practices for biosecurity vary depending on what the disease is. So we might need to do some diagnostics to figure that out. It's not always black and white to the veterinarian exactly what diseases they should be testing for, especially if the horse is just dull with a fever. It's kind of non-specific clinical signs. So the vet might have to kind of cast a wide net and test for a lot of different things and hope that something comes back positive. Or, depending on the budget, they might have to just go with what they think is most likely. So it's not always black and white how to approach these situations. Usually the vet is collecting either a blood sample, a manure sample, or a respiratory sample to try to make a diagnosis. And whenever we're in these situations where we have multiple horses on the farm and we're trying to determine if other horses are getting sick, we start temping horses twice a day. And just trying to catch horses with a fever will help us separate them into the potentially infected group and manage them a little bit differently so that we're not spreading disease around the farm as much as we can help it. But if we do have to isolate a horse on our farm, what do we do? So like I mentioned earlier, a separate paddock, at least a separate stall if possible, trying to maybe not have horses in stalls that have nose-to-nose contact, so we might have to have a stall between them, something along those lines. Preventing nose-to-nose contact. We usually will feed and clean up after the infected horse lasts. So we touch all the healthy horses first, stay clean that whole time, and then we handle the infected horses last, and then we wash our hands, clean our boots, change our clothes, before we touch any new horses again. You can wear coveralls. You can, take these on and off and, hang them outside the stall or paddock, wherever the infected horse is. We sometimes will even have a separate pair of shoes that we put on when we go in with the infected horse, or shoe covers. And then keep wearing gloves whenever possible, or at least washing our hands using hand sanitizer. Making foot baths and placing them outside of the infected horse's area, as well as at entries in and out of the barn, can help us keep our feet clean and keep us from tracking things around. You can do a 10-to-1 dilute bleach solution which will kill most of the infectious diseases that we've talked about. And it's very important with these foot baths that you keep them free of organic material like dirt and shavings, hay, because that will make them less effective. So, kind of cleaning the larger debris off our shoes before we step through the foot bath. And then when the foot bath does start to get kind of dirty, we should change it. So that might be multiple times a day if you have a lot of foot traffic going in and out of the barn. Sometimes, we put on, in the bottom picture on the right, we might, have disposable coveralls, Tyvek suits as well that we can use. In the hospital, we get like really serious. And when we're going in and out of isolation, we are, fully covered. Sometimes we'll even put on a face mask. And we use some commercial disinfectants. And sometimes veterinarians can have these disinfectants and provide them to barns when they're dealing with an outbreak. So that's all I wanted to go over today. Are there any questions about anything that I talked about?
I have an online question.
Sure.
And that is, I attend shows and events that require me to use temporary stalls for a night or two. Is there anything I can use to spray in the stall to sanitize it?
Oh, good question. Well, certainly the stall could be wiped down with a dilute bleach solution prior to going in. Probably the main thing, and I think also asking the show manager how they have cleaned the stall in advance would provide some peace of mind, which may mean that it's less important that it gets wiped down when you get there if you're really comfortable with the procedures at the facility. Do you have any other advice, Dr. Perkins? Okay. Yeah. Sometimes when we're traveling to shows and the material that the stall is made out of is wood, it's not as easy to clean. And so you do the best that you can, but some of these surfaces are porous, and you may not be able to get the stall really clean. It might not be practical to do that. And so instead, certainly making sure that there's clean bedding there and making sure that you bring in your own buckets, your own cleaning tools, and that your horse is well vaccinated. That might be the most you can do in certain show environments where you're having to use a temporary stall. Yes. That's a good question too. I think some of the things we might worry about with farm animals might be things like salmonella in the manure. That's kind of one of the main things that I would think about. But as far as the respiratory diseases, there's not a lot that cross between horses and cattle, so that's good. But at least making sure that you're not tracking manure between the two is probably one of the best things you could do.
Can you repeat the question?
Oh, sure. She's wondering if when you are traveling and your horse has to be housed in an area that has other farm animal species, are there diseases that you'd be worried about being transmitted between farm animals and other farm animals and horses? And I mentioned maybe some of the things that can be shed in the poop of the farm animals, like the main one, maybe salmonella. So careful with manure management. Yes.
I don't know if it's relatable or not, but so you're at a farm that had strangles, and that's the time you should have that were infected tested after the spreading. But there was that was by other borders, like other people that were boarding. Regulation that says that they have to have it done, because you're sort of stuck, like our pony didn't get it.
Right. Right.
So we're like, can we leave the farm or can't we leave the farm? I have to test the animal, or should I have to pay to have their animal tested before I can leave? Like, whose obligation is that?
Sometimes these situations do get complicated because testing can be expensive, and sometimes we run into those kinds of barriers. But typically, it's kind of on everyone to be a responsible owner, and if the recommendations for an infectious disease like strangles, they are usually to try to test those horses and make sure they're no longer shedding before they travel, so that everyone can kind of be released from the farm. We hope that everyone kind of cooperates in those situations. And in situations where it becomes concerning to the veterinarian that not everyone is adhering to the kind of quarantine instructions that have been set in place, that's when sometimes the state vets will get involved to ensure everybody's safety, to kind of get the ball rolling, make sure that the testing that's needed gets done, so that the situation can get resolved.
So we could put pressure on powers that be, say.
Yeah, your veterinarian can have a conversation if they need help, talking with their state vets to help kind of with making sure guidelines are being followed. Yeah. Oftentimes that doesn't happen because everybody does cooperate and is responsible and adheres to all the biosecurity regulations set in place. But when that doesn't happen, there are some options. Yeah.
I think we recently had a scenario where we're helping a group and thinking about when you're at a boarding facility, that the boarding facility maybe should have some guidelines on how they would handle an infectious disease situation, so that it's a little bit more clear to the boarders. Oh, that thing I signed in the beginning, we're supposed to follow that and maybe do some of this testing or whatever. So it kind of sets the stage and helps people understand that it becomes important to everybody at the whole facility, right? You can't have infection control for one horse and not the rest of them on the farm too.
It did seem to be a little unclear though, as to when we were free to go out, because one vet would say this amount of time and then the other one would come up with a different amount, and you're like, when am I safe to go? Or when are we free and clear? Because they had contradicting comments.
And that is
we're all
also the
dropping like
challenge with
flies.
boarding facilities where it's overseen by multiple veterinarians, and it's usually best that the veterinarians get together and make a plan together, really.
Yeah, because the horses are all in a shared space, so they should be all probably following the same guidelines. Yes.
We have pretty much a closed farm. We just have 4 horses. They don't really have any interaction with other horses, so our risk is pretty low for introducing these kinds of pathogens. But is there a recommendation if we're out riding and you meet other people riding their horse from their farm? Oh, stay 6 feet away from each other, or I don't know.
Right. I mean, I think the main things, if like say you're out on a trail ride and you're passing your neighbor's horse or something, yeah, just avoid nose-to-nose contact. Probably, try, if you stop to chat, don't let them sniff each other's poop. Don't pet your neighbor's horse,
Right.
if you, and then go and touch your own, those kinds of things. And the risk is low, as you mentioned, in that kind of a situation. Unfortunately, because as I mentioned, like even with herpes, it goes latent and then horses can recrudesce their own virus. So they didn't leave their farm, but now they are actually contagious to others. And so if you run into that horse on your trail ride and they touch noses, that's how your horse could get sick.
But luckily, most of the time, things are okay, right?
Yeah.
You see your friend on a trail ride, your horse is okay, their horse is okay, and mostly it's okay, huh?
Right.
Until it's not.
Only other time I was really concerned was some neighbors down the road had a couple of horses that they got loose. They came over to see our horses at our farm. They're sniffing noses across the fence and
Yeah, and they're all kind of stressed out and changed. and
just
stuff
very
like that.
excited to
Right.
see other horses.
Yeah.
Our horses were very excited to see another horse. It's like, I don't know what the big deal, especially mini horses. We saw mini horses. Their minds were blown.
Yeah, and that's why we have kind of what we consider our core vaccines. And these are diseases that we vaccinate against even when our horses aren't traveling a lot. And that's, we consider that these a risk to even horses that aren't showing and moving between stables. Other questions? Did everybody get to enter their name in the raffle in the back?
We're raffling on.
Anybody want to win? There's a Yeti.
Is it up next?
The
Oh,
seminar series first.
Oh, really?
Whoa.
I didn't put my head on it.
And then, well, next month, we're going to have one on pasture management. And then we have, some curry combs back here. And then some, calendars, so whatever you guys
Anyone else
would
need to
like
put
to
their name
grab, please do so.
And then, or do you want like?
Good.
You just want our name?
Yeah, you gonna draw right now? Yeah.
Yeah.
It's happening right
Right now.
Yeah. And then if anybody wants to let us know other topics they'd like to hear about, we'll be sticking around a little bit, or if you wanna write it on this form for the emails, what you wanna talk about at other times. You like having.
We have yet to discuss that. 'cause we
Yeah,
know
it's
this
the
is 90
shed.
minutes.
Yes, starting.
You already did?
Yeah.
That was being very messy and
I love it.
It's a little arbitrary.
Oh,
Yeah.
of course.
It's like 99